out before you, I'll let you know. But I think that's a better plan. All right, we're going live.
People stand by, don't by themselves.
A special good morning to you, our viewers watching in St. Lucia and St. Lucians watching abroad. This morning we are live on NTN on location from the Finance Administrative Center, Point Seraphim, and we are on standby for the start of the national consultation on a framework to reopen St. Lucia's society. My name is Jessie Leonce and I'm joined by my colleague as usual, Mr. Carlton Cyril. Good morning, Carlton.
Bonjour Jessie, et encore nous avons dit bonjour pour Saint-Lucie et pour ces gens qui suivent nous l'autre pays et sur Internet là. Quand vous êtes observé, côté nous en studio à bon matin. Bon matin, nous Financial Administration Centre là, ça c'est la Point Seraphim. Et pour attendre parler du gouvernement pour un plan pour ouvrir pays, ouvrir pays. Et bien, aujourd'hui, nous avons une consultation qui a pris coup. Et puis, tout le monde qui est involvé, consultation, ça a été conduit par ces gens qui têtent cette commande-là. Et puis, il y a tout ici, parmi les chefs officiers médical, Dr. Belmar-George, nous avons Gardner qui est responsable pour affaires délivrées. Nous avons permanent secrétaire des affaires touristes, des affaires Donalyn Vittet. Il y a tout ici parmi les ministres du gouvernement. Quand après le Premier ministre a parlé, au Kaitan, c'est Mounsa qui a présenté le plan. Quand rien au savent parmi bagay yo kay pour considération c'est les vini pour bagay kon santé les vini pour l'autre bagay qui a affecté ouvert pays et premier ministre a dit les vini pour sécurité pays quand tout ça qui point place yo kay mettre plan devant et puis nous kay tan qui côté nous ka aller qui manière bagay là kay fait quand moi Jessie et parmi tout le monde qui est involvé ici et nous menons rapport aujourd'hui ici en building financial centre administration en Point Seraphim.
Okay, and just to give our viewers, well, to add to what you said, just to give our viewers a sense of what is happening here this morning, I'm just going to read out a press release coming from the Office of the Prime Minister. Government holds national consultation on framework to reopen St. Lucia Society. The government of St. Lucia is continuing its strategic approach to St. Lucia's COVID-19 response, which has led to our island's keen management of the crisis and the announced recovery of all 18 confirmed cases. As the government charts the road to recovery, plans are being shared for the measured and phased approach to reopening St. Lucia's society. The framework for reopening will be shared at a national consultation from 10 a.m. today, May 15th, 2020. Following opening statements by Prime Minister, the Honorable Alan Chasney, the plan will be presented by the St. Lucia Command Center team, which includes the Chief Medical Officer, CMO Dr. Sharon Belmar-George, the Delivery Unit Director, Charon Gardner-Hippolyte, and Permanent Secretary for Tourism, Donalyn Vittet. The Prime Minister has explained that the five-phased strategic reopening focuses on health, safety, and the general well-being of the public and has taken into account advice from public health experts and feedback from various stakeholders. Today's meeting will be outlining specifically the types of businesses that may operate and level of activity permitted at each phase. The session will also provide the requirements for businesses and organizations across each sector to operate based on national COVID-19 protocols. The opening of today's meeting and the presentation will be carried live via the National Television Network, the government YouTube and Facebook pages via the following. That's our NTN Government Portal launch, the Government of St. Lucia Facebook page, the Office of the Prime Minister's Facebook page, and the Government of St. Lucia's YouTube channel. We have since seen a phased reopening as St. Lucia recovers from COVID-19, the effects of COVID-19. The island too is trying to reopen, have a phased reopening in the safest way possible of our sectors at this time. We've since seen the opening of the construction sector, capital projects, the resumption of capital projects on island. We've seen the opening of student businesses. The public transport has been allowed to operate at this time to facilitate, the ongoing sectors that are now opened, and the continuation, we'll be seeing the continued consultation, a national consultation on the framework to reopen St. Lucia Society. So today the representatives from the command center will be meeting, and we see so many stakeholders who are on standby via the Zoom platform right now, and they will be making their contributions to today's consultation. A lot of things to consider, primarily the trade-off between our health and safety measures, as well as considering the islands, the reopening of the economy, because we need a lifeline. We need to be able to sustain ourselves in St. Lucia, and so definitely the trade-off needs to be carefully managed. So we now are on standby for the national consultation on the framework to reopen St. Lucia's Society. Do stay tuned.
Et puis, oui, combien de temps, comme Jessica dit, vous avez bien observé les meetings, sa consultation, ça va continuer. Nous avons genre tout département, expressement, vous savez, les venus pour balancer ça qui a fait là. Vous avez bien connaître les venus pour protocole qui déjà établi. Nous en bas état de secours toujours, quand on savait dire. Pays ni pour ouvert et quand vous qui a suivi programme dans kai savent nous ni monsieur Tommy ici et puis nous qui c'est un économiste qui on sait ba il a dit c'est qui manière au ouvert pays et à même les suivre protocole et à même les on ni moins monde qui travaille moins l'argent touriste pas qu'à venir quand un chai bagay pour en considération mais ça qui bien bon nous hata nous kai ba mais nous ka nous ka prendre pause à présent merci tellement pour nous commencer
panel for the start of the consultative process.
And good morning and welcome indeed to this special stakeholders meeting taking place at the National Financial Center here in Castries. Let me just take a moment to introduce the head table. We have to my left, socially distanced, is the Prime Minister of St. Lucia, Honorable Alan Shastney, on the head table. Myself, Dominic Fede, the Minister for Tourism. We've got the, to my right, socially distanced as well, the Permanent Secretary in the Ministry of Tourism, Ms. Donalyn Vittet. To her right, you've got the Chief Medical Officer, Dr. Sharon Belmar. And then to the right of her, you've got Mrs. Charon Gardner-Hippolyte, who's the head of the delivery unit. And then to the extreme right, you've got Mrs. Nancy Charles, who's the Director of Implementation attached to the Office of the Prime Minister. I would like to also recognize the presence of the Honorable Gail Rigobert, Minister for Education and MP for Micoud North, who's also in this meeting here today. Would also like to recognize the presence of the police Acting Police Commissioner, Mr. Milton Daisy, along with other special dignitaries. On the Zoom, we have got members of civil society, the clergy, the local private sector. We've also invited the main opposition St. Lucia Labour Party and other important groups, and including trade unions and various companies as well. We are happy that you are joining us via various radio stations, via Facebook Live, and via cable television on Flow, on the NTN network. We are just about to begin a very important discussion as it pertains to the phased and strategic reopening of our economy, which we are dating sometime for the first week in June. June 4th is the date that we are looking at. We have been making a similar presentation and having dialogue with various groups, stakeholder groups. We had meetings yesterday with the leader of the opposition and trade unions. We've also been meeting with the Hotels Association, along with other important organizations within the private sector, with a view to getting the consultations. It's been a tremendous few weeks of organization and research that will aid the development of protocols which are necessary at this time for us to look at the reopening of our economy. The critical sectors, obviously, that are going to be impacted will be infrastructure, agriculture, the business sectors of commerce, manufacturing, tourism, along with a number of other sectors which are slated in a long list of protocols managed and organized and developed by the Ministry of Health. Before we take the presentations from the team in the command center, I would like to invite the Prime Minister of St. Lucia, the Honorable Alan Chasney, to deliver remarks today.
Good morning to all, and thank you, Minister Vittet, and thank you to Ms. Vittet, Ms. Belmar, Ms. Gardner, Ms. Charles, for the incredible work that you all have been doing and the amount of hours you've been putting in over the last several weeks. This morning I was able to attend an opening ceremony for a farm in the Roseau area, in your constituency, Minister, for a project that's being done with Castries Central, the Synergy project. And we got the benefit of a sermon this morning. And while I was at that sermon, the thought process that we live in a world in which we have an environment, Mother Nature. And sometimes Mother Nature changes her pattern of behavior. So we've seen it recently with the hurricanes. And to say that you're going to fight Mother Nature is very difficult. You have to adapt to the situation. So knowing what's been happening with the strengthening of hurricanes, those persons who don't strengthen their homes, or we don't do the proper desilting and take advantage of our knowledge and prepare ourselves for the calamity, then it's at our own cost. This pandemic has now created a change in our environment, and one in which we're going to be forced to adapt to moving forward. So first of all, our behavior, until there is going to be a vaccine for corona. But I assure you, the same thing that corona has done, we are still very susceptible in the future, because we never know where the next virus is going to come from. And what we've certainly learned through corona is how integrated the world is, and how accustomed we have become in physically contacting each other. And therefore, a lot of things that we have been doing in the past and been taken for granted needs to change. Similarly, the economic fallout of COVID is something that we don't have the ability of solving. And when you hear numbers like 36 million Americans are unemployed as of yesterday, and we were on a meeting with the airline industry, and you hear airlines saying that they're not intending to recommence services into the Caribbean until the summer of 21. Or you hear that 80% of the airlines have 3 months of cash reserves, and they're down to 1 month to go. Or that their prognosis is that the air traffic will potentially return to its pre-COVID levels by 2025. These are sobering numbers and tells us what we need to brace ourselves for. So today, we are here at a key juncture of our COVID fight. We started off this process to delay the impact of COVID as a virus into St. Lucia while we prepared ourselves to handle a potential outbreak. And I want to congratulate all St. Lucians. I want to congratulate the team here and the many persons that are behind these names that are putting in the hours that we have. And to say that, well done, St. Lucia. We've had 18 cases. As we stand today, there are no current persons in St. Lucia that we know of that have COVID. We've brought in, I think it's 220 St. Lucians off of the cruise ships who are currently in quarantine. And as I indicated, that over 90% of the persons that developed COVID after our 5 cases, 90% of those persons were already in quarantine or in isolation. And that's a tribute to the contact tracing team that we had here. We have moved into OKEU in very difficult circumstances and a hospital under normal circumstances that we would not have moved into because of some of the problems that are there. But we had no choice given the threat of COVID. And work has already begun in earnest at Victoria Hospital to have 91 beds available and dedicated to becoming a respiratory center. I think that I can say that St. Lucians for the most part, but the vast majority, have learned to change their daily behavior and to learn the proper social distancing. And so I really want to congratulate all of you on an outstanding job. The next part of COVID is to start reopening our economy, and that process has started. The plan that's going to be presented today is to outline for the next couple of months what we expect to see happen. And so therefore, persons can more appropriately and adequately prepare for businesses reopening and how that's going to work. So Cabinet has seen this presentation. The unions got to see the presentation yesterday, along with the... I'm just going to hold until we get that problem resolved. Thank you. So the plan that we're presenting today is the rollout, the final rollout of reopening our local economy to pre-COVID levels. But clearly, addressing the protocols that are required. And why are those protocols required? Because we're still under threat. A person can very easily, illegally come in from Martinique, or persons who believe that they're stronger than COVID, who go to Martinique, unwittingly get infected and come back home. So we're still under threat. And we have to be in a position that if at any point we see an outbreak, that we're able to adapt and move very quickly to isolate that outbreak, because we've learned how to do that. The next thing that we have to do is to figure out how to open up our international borders. And we've been hard at work, the team has been hard at work. And I'm very grateful for the opportunity given to me by the OECS and certainly my CARICOM colleagues to help spearhead this initiative So that it's not about just St. Lucia opening up its borders, but collectively the Caribbean would do so. And the lessons that we learned in coming up with a common CARICOM policy for the cruise industry, we must do the same thing for the airline industry and also for our hotel sector. So we work in unison. It doesn't mean that the timing of when we reopen is going to be the same, but the principles of the reopening and the standards that we're going to be putting in will be a common one. And each country will ascertain where it's at and make the determination as to when it wants to reopen its borders. So we've also had many of a dialogue, and the problem is, well, I wouldn't say the problem, but we must recognize that there's certain things, actions that are within our control to achieve, and there are certain actions that we have to depend on the outside world to achieve. So right now, Canadians who would come to vacation in St. Lucia would still have to go back into quarantine on the way home. Similarly in the UK. And so we can't expect that those markets are going to open up anytime soon until those protocols are taken down. We believe genuinely that through testing, we can significantly reduce the risk. And so we have to anticipate that very soon that there will be a rapid test that globally is accepted, that at least can reduce the risk of a person having COVID before they travel. And certainly we must continue with the protocols of taking persons' temperatures, watching persons' behavior, and at the same time making sure that if in fact they show any symptoms, we have the ability to isolate them quickly. Reopening our borders also means that we must get our local population to have confidence in what we're proposing in order for them to be able to go and work in those places and know that they're going to be safe. We also must give the tourist who is coming down the comfort that they're not going to get contaminated when they come here. And certainly that the protocols have to be significant where even on returning back home, that if we want them to take away the quarantine period, that everybody has to be satisfied that we've created what we call this corridor to protect each other. So this is not simply a decision that the government can make by itself. This is a decision that the government must continue to consult and encourage and hopefully get everyone's buy-in to make this thing happen. And I do mean everyone, because if one part's not working, none of it is going to work. So I'm very glad that we've reached this point today, and depending on the input that we get from all the stakeholders here today, we're hoping to announce these new protocols tomorrow, I believe on NTN, 10 o'clock, 9 o'clock in the morning. That's subject to subject to a general acceptance of what we're doing here today. If in fact we see through this call that there are some impediments or some things that we legitimately did not think of, it would then cause us to pause and go back to the drawing board, and hopefully that we can get some of those things rectified. So I don't want to give the impression to anyone that the decision is final. We're certainly waiting for the input of this team, but we are prepared and we are very confident that this is a very well thought out strategy, and I'm looking forward to the presentation. So again, I want to thank you, Minister, for your leadership, the Minister of Health also for her leadership in this issue. I know that Cabinet is very grateful to both of you for what you've done, and certainly from the technical staff, I can't thank your PS and Dr. Belmar and Sharon Gardner and Nancy Charles working out of my office. This has been an effort where literally they are going 7 days a week, 12 and 14 hours a day. I can testify to that, and I think that we all owe you a great debt of gratitude. Thank you.
Thank you very much for that, Prime Minister. Just in the interest of time, we will go straight into the presentations by the team. I will now invite Mrs. Charon Gardner-Hippolyte, who will begin the presentations and then introduce the other presentations that are following. Mrs. Gardner, over to Mrs. Hippolyte. over to you.
Thank you, Minister. Good morning, everybody. Thank you for allowing us this morning to make this presentation to you.
You sent them the draft.
It is a framework for us to reopen St. Lucia Society,
Okay.
and it is an assessment done by the Command Center.
I can't do so much.
How did we get here today? I will hand over to Dr. I will go through a chronology of events that basically takes us through some of the highlighted points as we traversed to where we are today on the 15th of May. WHO basically declared COVID a public health emergency on the 30th of January. After that, some of the highlighted dates as it pertains to us are the 28th of February, where the Prime Minister activated NEMAC. WHO informed everybody that COVID-19 was now a global pandemic. St. Lucia confirmed its first case of COVID on the 13th of March, and on the 23rd of March, we declared a state of emergency. A day that will go down in our history books is the 1st of April. A 24-hour curfew was imposed. On the 6th of April, we then reverted to a curfew from 7 p.m. to 5 a.m., the establishment of 2 zones, and the suspension of our liquor license. On the 29th of April, we launched our economic relief program. I'll now hand over to Dr. Belmar.
At this point, good morning, everybody. I will be explaining the public health strategy that we have been using in the management of COVID-19. We have not put in stage 1 because most persons can remember, and we had presented before, where stage 1 indicated our preparation stage, and most of the focus at this point was to reduce the entry of COVID-19 into our country. So a lot of the measures on the stage 1 included our travel restrictions and our monitoring of what was happening on an international scale, and it included a lot of preparation in anticipation on the arrival of cases. So apart from that, we prepared our health facilities, our healthcare workers, our other stakeholders, and it also included an aggressive public education campaign at that point. As we started to get cases from March 13th, and increasing in cases, we went into stage 2, which is one of the mitigation phases. At that point, our main focus was to slow down the increase in cases to reduce spread. So the public education increased. We also developed our capacity to test locally, although we still test with COFA off and on, but we ensured we had that capacity in Ireland. We also expanded our quarantine and isolation capacity with the use of hotels. We also ensured that we had a very exhaustive contact tracing procedure within the communities where cases were found. And also, we went from the modality of home quarantine to mainly institutional quarantine. We also canceled mass gatherings at that point and implemented the physical distancing measures. We also ensured our supplies of personal protective equipment was present and ensured a supply chain to ensure sustainability. As our cases increased, and if you note that in stage 3, which speaks of established community spread, we never fully got into that phase because our cases were limited to specific areas. We did not get cases throughout all of the communities within St. Lucia. However, in a proactive way, a lot of the measures were taken to ensure that this was managed in a very aggressive way. So the Unified Command Center from out of the Office of the Prime Minister, which was established a lot earlier, continued, and the 24-hour shutdown and curfew, as well as the state of emergency. at this stage that we are now in recovery, at this phase, there are a number of things that we could see based on where St. Lucia is, based on our cases. At this point, where all of our 18 cases have recovered fully, our testing results, which we have received over the last few weeks, have all been negative, and we have changed our testing strategy to cover our various communities, and our testing to date have been negative. So we continue onto that phase of recovery. There are three main ways that this disease can progress, three main outcomes, I could say. We could see a complete interruption of human-to-human transmission at this point. That is, we completely block the virus, not seeing any more cases in St. Lucia. This is quite unexpected, unlikely, I should say, because as you know, we remain susceptible as a country since we have not had widespread outbreak. So as it is known, as we continue to reopen, there is the risk of entry of cases, and every country has to be prepared and need to be cognizant of this. The other possible outcomes include recurrent epidemic waves. We just went through one epidemic wave. It is quite likely that we will continue to get cases, this with low-level transmission. So we have to ensure that as we have been preparing and strengthening our healthcare system, that we are able to manage. The reality at this phase is that we have to be prepared that as we get cases, ensure our system is aggressive enough to identify them and to also manage them. So our expectation is that we have recurring low epidemic waves, as is seen in a lot of the country, the region, avoid the possibility of a large epidemic wave as we see in some countries within the international zones. But we, St. Lucians, we have to be prepared to live safely with COVID-19 at this point. So as you go through what is being proposed, you will note that with every sector that opens, there are very strong guidelines to go with it to ensure that the transmission of COVID-19 at every level is reduced. This is our dashboard as of yesterday. I will go through some of the information there. We've done a total of 727 cases to date, and this is both tests done. Yes, a total of tests done, 727, a total of done locally and with the Caribbean Public Health Agency. Of our 18 cases, 2 of those cases have been repatriated. All 18 have recovered fully and have been discharged from our respiratory hospital. We have had none of our cases have been complicated, and we've had no deaths on island. This dashboard is going to be updated for today because we have received the samples for 59 tests done from the community in our respiratory clinics, and all of the 59 have been negative. So our status of 18 confirmed cases with all recovered remains to date. But we will be increasing the number of tests done to add on the 59 results that we received past that date. This gives an idea of the public health monitoring and the indicators that we use to assess where we are and to ensure that we manage COVID-19 and to keep our numbers down. It gives an assessment of where we are to ensure that we remain at a certain level. And if you go through some of them, I will just choose a few because of time. We look at the incidence of of COVID-19 per 10,000. We remain at 1, and our indicator is to be at 3 or lower. Also, if I look at ICU hospitalizations for COVID-19, which we have had 0 of, and we really are managing. I have to commend the clinical teams on the ground for the work that they have been doing, managing positive cases at the respiratory hospital. We look at our recovery rate, which is at 100%, our testing rate, which we have met because our testing strategy at this point is to test everyone with respiratory signs and symptoms to ensure that we are picking up everyone. Included in those are persons who die. To ensure we do not miss anyone, we have included in our strategy from the beginning to ensure that we test persons who die, sudden deaths, deaths due to respiratory. We test all of those to ensure that we have not missed any cases throughout. We are still, as in the region and on an international level, testing remains the biggest gap for most countries. We are still working to reach our goal. We want to see at least minimum time, 24-hour turnaround time, which we have not been able to keep up, and we continue working to see how we meet that strategy, and also the capacity for testing. Most countries, like St. Lucia, we are unable to sustain continuous local testing because of the unavailability of reagents. So we continue working to see how we can manage that to ensure we can sustain our testing throughout. However, the Caribbean Public Health Agency continues to work with us to ensure that there is no gaps or breaks in testing to date. This is to give you an idea of our cases over the weeks, and you will see our curve. We are now in May with 0 cases coming out every day from our testing. The orange line gives an indication of our testing capacity throughout the months. Earlier on, if you look at from week 11, you will note that we tested a lot less. During that phase, we use the case definition for COVID-19 to determine who we tested. That is persons coming in with a travel history and developed signs and symptoms, or someone who was in contact with a positive case. As we developed cases within the country, as you can see through week 13, our testing strategy changed to test everyone with respiratory signs and symptoms, and we also put a focus within the communities, with certain communities having a greater focus because of the number of cases that we noted there. So we plan to continue and to increase testing to ensure that we have a very efficient way of picking up cases if they were to come, to ensure containment and to reduce the possible impact of COVID-19.
This now takes us to our framework for reopening our society in St. Lucia. So as Dr. Belmar indicated, we went from mitigation and we're now moving towards a phase where we are looking at recovery on many levels. We are proposing that our economy and our society basically opens in 5 phases. There's phase 1A and B, 2, 3, 4, and 5. At each phase, we will outline what would be allowed to operate and the level of activity that permitted at each stage. Provide the requirements for businesses. More detail would be provided by the Ministry of Health and Wellness in relation to the protocols and guidelines for each business and the level of activity. We all need to understand that this is a new way that we have to operate. There are going to be national protocols in effect to mitigate the spread of COVID and any potential outbreak. We need to ensure that there is good information and communication being given to the public. These are our phases. The first phase was 1A, and it was essentially looking to slow the spread. Everybody remembers the 1st of April, where primarily our only areas that were allowed to operate were our health and our security and our utilities. We were under a 24-hour curfew, and physical distancing was very much in effect. People were not allowed to leave their homes. School was suspended, tourism was suspended. We then moved to the cycle of 1B. Again, some of our businesses were allowed to operate, but focus was on essential services. Our curfew was reduced to 10 hours, and school and tourism remained suspended. Phase 2, we allowed for minimal operations. We allowed for other services to be able to open and to provide some measure of service to our community, particularly when you had to look at things like our impending drought season. We remained the curfew of 10 hours, and tourism and school were suspended. We now move to phase 3. This is the current phase that we are in right now in St. Lucia. And we refer to this phase as increased incremental operations. And the reason being is that we are currently in the third cycle of phase 3. We had the first cycle where we allowed some businesses to operate. We allowed for particular components of that sector to be able to operate. And then every week we gradually allowed for a little bit more. There was a 10-hour curfew, continued to be in effect. We allowed for persons to be able to exercise. There was some relaxation of our religious practices. And at this point, we are making provisions for persons to be able to undergo national examination. In respect of tourism, we allowed for a feeding program and also development of industry licensing. Moving forward into phase 4, we're looking at allowing for our economy internally to be able to operationalize and to be able to have all of our sectors operating. Some of them at different levels, depending on the type of operation that is in effect. Our curfew, we're looking to reduce it. We are hoping to have domestic and travel and international travel resume, and also allowing again for provisions for national examination. With respect to the tourism sector, we are going to be allowing for our airports to open. Now, what I need for everybody to appreciate is those are our goals, those are our aspirations, and we have to work towards a goal and an aspiration. Otherwise, you'll be mindlessly wondering where you are going. Phase 5. Finding our new normal. This seems to be the catchphrase of the day. What is going to be our new normal? It certainly is not going to be life as we imagined it prior to COVID, but everybody has to appreciate in every single sector it is going to be radically different. Our international travel can resume, but with very strict protocols. Social, public must accept and adhere to the new norms. In relation to school, again, we are allowing for national examinations, and with respect to tourism, the full recovery and reopening, but again, strict adherence to protocols. So we're going to go into a little bit more detail in relation to each of those phases and what were the goals and aspirations in each one of those phases and what were some of the steps that were considered. For the purpose of this presentation, we don't necessarily go into great detail as to some of the specific guidelines for every single sector, but Dr. Belmar will interject at some points and indicate to you some of our most pressing areas. So phase 1, we spoke about a bit earlier as well, was on the 1st of April. What was our goal in this particular phase? It was to control the spread of COVID, to ensure that everybody was placed in self-quarantine because we did not have the capacity to ensure that St. Lucia could manage COVID at that particular time if there was a potential outbreak. Everybody had to go into self-quarantine. Our national protocols was everyone had to stay at home unless you were an essential worker. Some of the steps that were being required is that we enacted a 24-hour curfew. All public spaces were closed. There were no social activities, activation of a 311 hotline, and population being sensitized with a lot of communication about what was expected of them in relation to COVID. And then finally, our most important was what were our triggers to be able to move forward. And this is particularly key, and you will observe it in all of all throughout the presentation. We must ensure that community spread is minimized. We must ensure that we have the basic cooperation of the public. We must have established well quarantine and isolation facilities. And at the time, on the 1st of April, our quarantine and isolation facilities were at their maximum. We had to ensure that there is effective communication. Phase 1B. What were the goals in Phase 1B? Again, controlling the spread of COVID, ensuring adequate functioning of our essential services, ensuring and sustaining lives and livelihoods in St. Lucia. Some of the steps in this particular area were our 10-hour curfew, restricting of all social activity, protocols for our supermarkets, and as St. Lucians lovingly refer to our two zones as 758 and 759. I think that one will also go down in the history books. Our triggers to move forward would be community spread, again being minimized, ensuring that we had a sufficient supply of personal protection equipment, ventilators, preparation of our in-country testing, and our capacity in our respiratory hospital, our Victoria Hospital. We needed to again make sure we had sufficient capacity in our quarantine and isolation facility, and about this time, a number of persons were being released from those facilities, so capacity was being available. We needed to make sure that communication is key. Now you will note at this particular time, you will see that there are triggers now to revert. There are some things that we considered at this point as what would allow for us to be able to go back if we have a crisis in St. Lucia. It was 4 new cases based on our projections with no established epidemiological link. Apologies. Thank you. That's a tongue twister. Increased hospitalizations due to COVID-19. Going into phase 2, we can see that under minimal operations, our goals were to assess our healthcare system capacity. We were looking to reintroduce some non-essential businesses. We had our curfew still at a 10-hour. We are restricting again our social activity, making sure people left their house and that they always wore their masks. We wanted to continue to make sure that we had increased personal protection equipment being sourced and brought into St. Lucia. Again, what were our triggers for us to be able to move forward? We made sure that we had a sufficient capacity for us to do contact tracing when persons came into contact with a person who was positive, and that we had the requisite number of space available in our quarantine and isolation facility so that if we had a potential outbreak, we had the capacity. Our triggers to revert, again, for no more than 4 new cases a week without any epidemiological link. And we also needed to make sure that if there was no compliance by the general public in relation to the protocols, that would have to be a mandatory trigger for us to revert. Phase 3 is started on about the 27th of April, and we are still in this phase right now. As I indicated, we are going through a 3rd iteration of this cycle, where we have been gradually opening up every single sector. What were the goals in this particular phase? Implementing reopening of the economy through small little baby steps that would allow us to stop and assess where we are at each point. Continuous revisions to each of those phases, and making sure that the public were complying to all of the protocols. You will notice in our steps to be required there's this added measure of ensuring that with every phase, you're allowing for a 14-day assessment. And this is what we are proposing right now. St. Lucia is heading into another phase, hopefully on the 18th of May, and you would allow for a 14-day assessment for what the businesses that are allowed to open, and to ensure that with those little baby steps, we are monitoring, we are evaluating, we are making sure that before we move to the next phase, we have ticked off every single box. So what are those phases to move forward? That everybody in the public is wearing their mask when they leave their home, that they're practicing social distancing, that they're following all the standards that have been set by the Ministry of Health and Wellness, that there are no more than 10 new cases for a period of 14 days, that the community spread is 0.30 less or lower, or in the slide that Dr. Belmar spoke about earlier, where we referenced it at 10,000, it should actually be 3.0. Contact tracing app is activated, that we have a 21-day supply of personal protection and equipment on island in the event of the more than 10 persons having contracted COVID. We are in a capacity to be able to sustain ourselves in our health sector. Increased testing, and also making sure that our human health capacity at our hospitals, our respiratory centers, and throughout St. Lucia is at its maximum. What are the triggers to revert? No more than 5 new cases per week, with no established epidemiological link. Any shortcomings in our health sector in terms of preparedness would result in us reverting to a previous phase. We are diving into phase 4. What are our goals? Large stimulation of our private sector and our economy. We want to ensure that our healthcare system at this point is fairly resistant, and that we are resilient, and that we're able to withstand any of the shocks that are going to come our way. If we want to build capacity, and we must make sure that our hospitals are able to withstand any potential outbreaks. We are reinstating some of our soft social skills, and we're looking at reopening our tourism sector. Our national protocols would include making sure your basics, make sure you understand that you must keep physically distancing, and all of the social protocols identified by the Ministry of Health and Wellness. Gatherings are also limited. We are expanding our travel to regional. We're looking at all of our internal sectors now open. And we are making sure that in respect of our education, that we are allowing for our regional and international tests to be, examinations to be performed. With respect to this area, we are looking at triggers to move forward. 5, similar to the ones before, no more than 10 cases. The contact tracing app is in full effect, but what has increased at this point is that we want to make sure we have more personal protection equipment on island. Our testing capacity has been beefed up, and that we are in a good position in our health sector. What are our triggers to revert? Making sure that our health sector is able to withstand any shock, monitoring for any deficiencies, and if we had 30 cases in cluster, then this would be an automatic trigger for us to be able to revert. Finding our new normal, phase 5. What is our goal? International travel to commence with strict protocols, hotel and tourism sectors to be able to open up again with very strict protocols, and some of this will be discussed in more detail by the Permanent Secretary in the Department of Tourism. Steps required in each phase is vigilant screening at our ports of entry, mass testing programs, and continual refinement of new standards and protocols. As we continue to develop, and each time going into a new phase, we have to make sure that the protocols and the guidelines are constantly being monitored, evaluated, being implemented in all of our sectors, and that they are also being updated in accordance with international best practices. Triggers to revert is if we had large increase in our community spread and they were traced to our international borders. Moving forward to finding our new normal. Some of the protocols that we can discuss in relation to all of the sectors that we spoke about, our economic sector, our tourism sector, our social sector, and our education sector will be discussed by the Permanent Secretary in the Department of Tourism and also with respect to Dr. Belmar. Dr. Belmar, if you can maybe speak to some of the things in relation to our protocols for education and for our economic sector and our social sector, please.
Thank you, Mrs. Hippolyte. As we have moved from phase 2 into phase 3 with the opening of our essential services first, we have ensured that at every level as we move forward, that we have protocols in place for the various sectors to reduce any possibility, reduce the risk of any possibility of transmission at that level. We saw it with the supermarkets, we saw it with the hardware stores. And these protocols, our focus is to reduce any possible transmission. So they take into account the occupational health and safety guidelines for the workers within those facilities. We also look at the public health and social measures, and those include requesting that everyone who goes out use a mask. We also looked at infection prevention and control measures at those institutions to ensure that there is regular cleaning, and of course your physical distancing measures where we limit the number of persons within any institution at any time, and also ensure that even waiting outside that they're able to ensure physical distancing happens. In relation to the schools, we have been working closely and collaborating with the Ministry of Education, and together a number of in the discussion and the decisions have been made over the months. And some of those include, as you're aware, very early, the closure of school for the third term to facilitate the online learning mode. And in this phase that we are now in phase 3, our discussions have been on the facilitation of national and regional exams, that is the common entrance and the grade 6 exam. So as we continue collaborating with education, we decided that the rest of the school community would remain closed except for those critical years and those with the practical component. So we have prepared very strict guidelines with the Ministry of Education to ensure that the limited period of instruction is done safely to reduce transmission, to facilitate the common entrance exam, and to facilitate the CXE exams in the Form 5s. So we are hoping that we get the cooperation of the various stakeholders with that. So as we continue moving into phase 3 with the rest of the non-essential services and also some of the other sectors such as exercise and some of the social activities, we really need the public to work with us. We acknowledge and note that COVID-19 has had the psychosocial, psychological, the mental health impact of COVID-19, and also in terms of our chronic disease patients. Last week, we concentrated a lot on the holistic approach to COVID-19, that is teaching our chronic care patients the importance of staying healthy in the COVID-19 environment. That is the importance of healthy eating, exercise, staying on your medication. And we note and we understand why it was done, but prohibiting exercise, beach activities, swimming, tennis. A lot of that is very important in persons, everybody remaining healthy. We also saw the psychological impact of staying at home. So we are saying that the releasing of some of the social activities with some of the expansion of the non-essential services is to assist with our patients and everyone staying healthy, and also to help to reduce some of the psychological effects that we note in relation to COVID-19. But we need the full support of the public to ensure that it is done as per protocol and it is done safely. Families on the beach, but not a huge beach party. Mass crowd gatherings will still not be allowed so that we reduce any possibility of transmission. So we continue working with all of the sectors that are going to be reopened, and our environmental health team will continue working with them to ensure regular monitoring and that a safe environment is given as we learn to live safely with COVID-19.
Dr. Belmar, for the benefit of the public, you spoke about sports. If you can just maybe give an idea as to what the new regime of a sport would look like.
Thank you. For sports, we would still not want sporting activities with a large audience. We prefer activities where there is less direct contact with other persons. Sports such as tennis, some of them are more amenable than others. We note that in some communities, sporting groups have taken it upon themselves to start back. We see persons playing out in large groups. We still do not recommend this. So as much as possible, we want it to be family groups and limited numbers for those activities.
Thank you. And if we can hand over to the PS in tourism, who will take us through what the new normal would look like for tourism.
Good morning, everybody. Thank you. At the command center, the vision is that lives and livelihoods, with the focus on lives and livelihoods, are effectively safeguarded during the COVID-19 pandemic by a prepared, coordinated, and inclusive multi-sectoral approach. And while we have that vision of the command center, because of the broad-based nature of tourism, the decision was to zoom in on tourism, and zooming in, we are also guided by the livelihood component, but also in a way that risks are mitigated. So it is therefore to reopen the tourism industry in St. Lucia with a licensing and certification program to ensure adherence to standards while mitigating the risk associated with COVID-19, but at the same time, being able to maintain our destination competitiveness that we have been able to do for a while. So you would have heard Mrs. Hippolyte and the CMO refer to baby steps. And so within that framework of looking at the resumption of tourism activity in St. Lucia, there are baby steps. It is important to note that we have identified a two-phase approach, with the first phase being a test piece for the first baby item here. So the idea is to limit the various services within the tourism industry to focus on formal accommodation, tourism taxi, as well as the day boat charters for some very limited excursions. The other aspects of phase one for the tourism resumption would be that we need to have a dedicated team to assist the Ministry of Health in looking at inspections and adherence to protocols. It would also mean that there is a very strong training and communication plan that will go behind protocols and ensuring that the public is informed of the various activities going on and the progress to date. So on the screen, you will see a graphic. What this brings into focus is the various stages or the various activities within the visitor journey. So the idea behind this at the command center is to critically look at the various phases and identify what is required as a risk mitigative step and prevention where possible for visitors coming into St. Lucia. So you would have phase 1, up to 5. And it really starts from the visitor journey, from the time the decision is made or the thought process of wanting to travel, where there is strong education and sensitization with tour operators and the travel community of what the expectations of St. Lucia to protect ourselves as well as our livelihoods is. And really what that means for us. It means that persons coming into St. Lucia will need to meet the prerequisite of a negative COVID test within 24 hours to 48 hours of travel. And we just want to underscore that because we imagine that where we found ourselves at some point in the management of COVID was the importation of cases. And so it is very critical for us at the command center and at the various government agencies to ensure that there is a strong management and requirement so that we could minimize risk of importation as much as possible. So if we start to take you through these phases, 1, we have mentioned the strong education component of the travel community. So a visitor comes to the airport and they would have to present evidence indicating that they are negative for COVID-19. There's also mask, physical distancing, temperature screening, a regular sanitization of surfaces, hand washing regime, and education of all airports involved and all participants within the chain at airports and the airline community. You'd have also heard the Prime Minister indicating strong dialogue at the OECS and CARICOM level for the past days and weeks, where all of the countries are trying to get a united front on the management of COVID and what the protocols for resumption of travel and tourism would look like for all of our countries. And one sticking point is that all visitors coming or resuming would be required to have that negative COVID test. So if we move to the flight, which is the next stage, we also have the dedication from the airlines that protocols will be adhered to include mask, physical distancing, and minimizing the contact with cabin crew as well as in-flight service, looking at things like packaged meals, ensuring that there is limited interaction of use of washrooms on short flights as much as possible, ensuring that there are wipes of course with the right chemicals in use for visitors on flights to use. On arrival at the airport, there are protocols that already have been given by the Ministry of Health to the St. Lucia Air and Seaports Authority, and we could attest out of engagement with SLASPA and the other service providers that there has been work in instituting these protocols in lieu of travel. Some of the activities there within the protocols to note is the sanitization of luggage, the queuing up and ensuring that there's a slow process in deplaning so as not to allow large congregations. There's also increased infrastructure for fever monitoring and other screening at the public health station at the airports. At the hotel, or rather from the airport to the hotel, it's only authorized tourism taxi, which will be authorized to transact business at this time. Suffice it to note that with the protocols issued by the Ministry of Health, all tourism service providers in the first phase, which is the test phase, will be required to have met all of the protocols and to be issued with a tourism license from the Ministry of Tourism to indicate that they could commence operations. We also have at the hotel, the level of participation with the protocols would include a revision of the guest reception procedure to ensure that all staff are outfitted with PPEs, to ensure that as far as the restaurant and dining is concerned, that the buffet service is revised. And so there would either be no buffet service or a system where the food is enclosed and you have an attendant providing service to visitors. The hotels will also be required to have an extended opening of a nurses station to assist in daily screening, as well as to be able to assist the Ministry of Health in collections of samples where it may be seen that persons are presenting themselves with anything looking like COVID. Hotels will also be required to keep a minimum stock of empty rooms to assist for quarantine in the event that there's any cause for concern, where the management will first happen at the hotel and then pass on to a national public health facility. Physical distancing, signage at the hotel, training of staff as well will be required to leave their uniforms at the hotel, and the responsibility now will be placed on the hotel to ensure uniforms are laundered, to sort of prevent staff from walking on the road with uniforms where they could be in interaction with other persons and probably have some level of contamination. Whereas all of these are not bulletproof, they are strong enough in the opinion of the Ministry of Health, and if I could join them in that, and the Ministry of Tourism, that these procedures are set to minimize risk and sort of prevent them as much as possible, where at the same time there will be strong monitoring by the Ministry of Health team and at the command center on triggers for the government of St. Lucia to decide whether or not there is a stoppage, there is a review, or there is a continuation moving on to the next couple of phases. And with a view of moving on to the next phases, then we would be in a position to evaluate whether or not at this time we bring in more services. Just as the Ministry of Health has been ushering the opening of various aspects of our economy, looking at even alcohol, looking at essential services and non-essential services, and bringing on services in incremental steps, you would also appreciate that with tourism, we have a wide gamut of services, and the same principle is going to be used for bringing in the various levels of service, with a view of only starting with the core essential ones for accommodation, tourism taxi, and day boat charters. All visitors, just to reiterate before I pass on to Mrs. Hippolyte, all visitors will be required to stay on property. We are endeavoring to limit the interaction of visitors with the public, and so at this phase, while it's the view of the government to ensure linkages and community tourism in the first phase, this is not going to be allowed, but it is going to be considered only at the time there is sufficient confidence built with visitors coming in that we are able to mitigate and prevent importation of cases and community spread as much as we can.
Thank you very much, P.S. I just want to remind everybody that at each phase, we have, general and specific protocols for each of the sectors. So whilst I'm about to go into what is the proposed reopening strategy and the proposed dates, the emphasis has to be placed on, is your sector ready? Have you gotten your protocols from the Ministry of Health and Wellness, and have you implemented those protocols? So, for example, if I can ask CMO if she could just maybe give us an example of a type of a protocol where it's general and specific, and then also to indicate whether that the industry, if it's not ready, should obviously stop and wait and make sure that they have implemented.
Every sector and organization, they have specific aspects of their operation that relates only to their organization. For example, a supermarket that we've worked closely with them, there are certain general principles that relate to all organizations. I'll start with the general principles. That is, for example, the occupational health and safety, to ensure that the staff are well catered for. If you look at the supermarkets and some of the measures that they put in place, like the Perspex glass to protect the cashiers, the hand sanitizers as well, and some of the measures to facilitate physical distancing. So these measures, and also reducing the number of persons coming into the supermarket. So for most organizations, there are some basic principles that they have to look at and relate it. The occupational health and safety, like I said, infection prevention and control to ensure regular cleaning of surfaces where there's heavy use by persons coming in. We also looked at other general measures, such as your public health and social measures, which included asking everyone to use a mask when coming into the organization. With our various groups of sectors, if you compare a hardware store to, say, a construction site, or to a hair salon, for example, there are special measures that they would have to put in place. A hair salon, for example, would have to look at strict adherence to the appointment system to reduce people waiting to be seen, the use of masks, using only one-on-one, cleaning of the site after every client. This protocol would not be the same, for example, for a supermarket where you would not clean after every client, but you would clean after a certain number of hours based on the number of people who are coming in. Also for the construction sites, the protocols were quite different, looking at where the risk of transmission would be. Most construction sites are open areas, so it included from the transportation site, because we saw some areas of high risk where persons being transported to the site, maybe at the back of an open van, and maybe a lot of them at once. So from transportation to getting to the site, to how things are managed on the site and to where they are leaving. Some sectors are more complicated. For example, the tourism sector, with the number of different areas to look at, and we did have to do a full walkthrough of that sector and look at every single possibility of transmission at every level. So we have been working closely with the sectors as we learn to live safely with COVID-19 to ensure that transmission is reduced at every point, and also if there were to be a case, we would have to ensure we can contain very easily to reduce a possibility of spread into communities.
Thank you. Thank you, CMO. So now we're going to take you into our proposed reopening schedule. And you probably are asking yourselves, how did we come up with this? So a model was created that essentially scored and weighed all of our services across all the sectors. There were 5 areas that were scored. You got a health score, an economic score, a social score, a risk score, and also a protocol difficulty score. So every single sector, every single service was given a rating in relation to those scores. And what I'm about to show you is how you ended up with each of the services in each of the phases and how we are proposing to open. So I won't go into great detail because we have passed those phases, 1A and 1B. In phase 2, you can see that more services were being offered and allowed. In phase 3, which is where I would like for us to talk and spend a little bit more time, because this is the phase that we are currently in. Phase 3, thank you. Okay, so in phase 3, you can see that there was full operation and minimal operation. This is in keeping with our SIs that have been published. Under full operation, you have your health sector, your hospitals, and under minimal, you have all of the services that we currently have being operational. Moving forward to the 18th of May, we are looking at allowing for full operation of all of those services, because we've allowed for a 14-day cycle with all of those services, as you can note. From the 27th of April to the 18th of May, that 14-day assessment cycle has worked its way through the system. However, what I think is important for everybody to appreciate and understand, that full operation is not full operation as everybody understood prior to COVID. Full operation is finding our new normal in relation to working with COVID. So if I can ask CMO to maybe give us an indication as to what exactly would we now look at in relation to full operation on a more practical level using one of the services that are up there on the screen.
Thank you. Full operation in an era post-COVID is not like we saw before. At every level and every operation, we need to look at the measures that need to be put in place to reduce transmission within your sector. It would mean a number of things. First of all, you need to do a risk assessment of your company. You need to look at your workers. You need to look at the physical environment as well. In relation to the workers, in terms of occupational health and safety, you may have some workers who may be high risk based on their chronic health conditions. So these workers, it would be advisable to ensure that the environment in which they work in or work from home. So it means you need to assess to see what can still be done through the work from home modality. And for those persons who have to come in, you need to look at the square footage of the environment to ensure that there is adequate distancing during the work environment. So this is just a few of them. It also means that the wearing of the mask needs to continue during the work, and when they interact with customers, you need to ensure the number of customers coming in at any one time. You need to ensure that you have hand sanitizer, facility for hand washing at every sector. COVID-19 is not going to go away soon, even though at present our test results have indicated that they are negative, but the world around us has COVID-19, we remain susceptible. So over the next few months, and I could see over the next year, we have to change what we do and how we do it to reduce transmission at every phase. So these are just some of the measures that need to be in place for every sector that is opening and every organization. The regular cleaning and disinfection that needs to be set up. Also, measures such as ensuring that anyone with respiratory signs and symptoms stay home or go to get care. So each head of an organization needs to look at a very critical way of doing things, because you would want as much as possible to reduce transmission at your place. The Ministry of Health, we remain available to provide whatever support and guidance to agencies, although we have produced most of those protocols and shared to ensure that guidance is available.
Right. And just on that point, CMO, if you can just expand a little bit so persons can appreciate. The guidelines are general, then they get specific to the sectors. But even within the sectors, depending on the size of your business, depending on the customers that you see, if you can just maybe speak to it so persons can understand that even though the guidelines are general and specific to the sectors, that they need to even become more specific with respect to each person. So if we were to take, for example, the area of a beauty shop and what that would look like post-COVID. Well, during this era.
During this era of living with COVID. Well, the beauty sector, for example, a hairdresser's shop, the guidelines would be general to include your infection prevention and control measure between, before and after every client, regular disinfection of the area, ensure ventilation of the area. Also, your occupational health and safety for the persons who are there. It would mean that the person that the clients coming in would need to wear masks, and also the person providing the service would also need to wear masks. Waiting in the waiting area as a group would not be able to continue. It would have to be by appointment system. A service such as that would also need to keep a clear schedule of who was in the facility at the time, and at what time, to facilitate contact tracing if it needs to be done at a later date. Some of the other measures that we can look at for a service such as that is to ensure before anyone comes in, a level of screening is done to ensure that they're not sick if they have respiratory signs and symptoms, ensure that they get care and not come back in to possibly transmit a respiratory illness to the rest of the clients.
Thank you, CMO. Under this third cycle of phase 3, you also look and note that we are allowing for gyms and exercise to open up in relation to sports, looking at no contact and no competitive sports in this area. So I'm afraid no basketball games, no football games. However, sports like running, where somebody would like to do some training, those types of activities can be permitted. Opening up of the beaches. CMO spoke a little while ago about our beaches being available for us to go with immediate family members. So you're not looking at all at any beach bashes, no large groups, but just your immediate family member to be able to go to the beach as we have done in the past. The important thing is that everybody appreciates that this is not going to be how it was before the era of COVID. Moving on to the next phase of phase 4. We are proposing, and again, these are goals, these are aspirations. They are dates for us to look forward to and to see how we can implement towards those dates, so that persons in the various sectors can start to mobilize. And if it is that you have not received the guidance and protocols, as CMO indicated, most areas have received their guidance and protocols. If you have not, then you can start to say, well, let me contact the office so that I can receive my guidance and protocol. And even if you have and you are unclear, you can contact the office to be able to receive more guidance. In relation to moving forward, we now have all of our sectors opened up. And you will note again that we would have gone through a 14-day cycle, a 14-day assessment period for us to stop, wait, observe, having opened up a little bit more, and to monitor and make sure that everything is on point before we can move to another cycle. So if we recall the slides indicated before, what were our triggers to move forward? Making sure we had enough personal protection equipment, we had testing capacity, we had sufficient capacity in our health system for us to be able to take it to the next level. In relation to minimal operation, we would be indicating that these sectors would be allowed to open with strict guidance and protocols. So for example, your cinemas, functions, again, would be allowed to operate, but everybody needs to appreciate that it would not be like before. CMO, if I can hand over to you to give some guidance as to what those sectors would look like, please.
For mass crowd gatherings, which remains a high-risk area for us, there would be limitations in the numbers that are allowed within a closed space, similar to the guidelines that went out for the churches, where the numbers depended on the square footage of the organization at the time. So for mass crowds, there'd be a number of guidelines, first of all, in terms of the ensuring that persons with respiratory signs and symptoms are not allowed into the activity, and also limitations in the numbers coming in for activities that are closed up. So all of those, we will be working with the event sector to ensure it's done with a wide range of stakeholders before those are finalized.
And then moving on to phase 5, which we have referred to as finding our new normal, you will again note that more sectors would now start to operate at a full operation because everybody has become accustomed, having gone through 2 iterations of 2-week periods. So it would be the entire month of June operating under minimal operation for everybody to start to appreciate what is expected of them during this particular era, so that moving forward into the phase 5, we understand that full operation, whilst it's referred to as full operation, is a new normal of how we are to operate. We would be allowing for our returning nationals, and I would also like to allow for CMO to speak to this sector as well, please.
We have been working with the Ministry of External Affairs, the Ministry of Health, and the Ministry of Tourism. We have been working with our nationals that are in other islands to get a safe way to bring them back. This has started with at least two phases of the nationals on the cruise sector. As you are aware, our last batch of nationals was about 219 people who came through and are presently in quarantine. The protocol so far is that everyone who comes in would have to be quarantined. We have a special committee that is working on those modalities to ensure that it meets our capacity and it is regulated at that level. So our nationals will be allowed to come back home with the opening of the borders, but it will be done in a regulated way, similar to what we did before for persons coming in through the quarantine process, which we oversee by our community health team.
CMO, I may have missed it a second, but have you indicated the number of persons who have gone through quarantine to date?
Yes, to date, for quarantine and isolation, we've managed over 900 people at our sites.
Thank you. This concludes our presentation in relation to our phases and how they will be opening up. More details in relation to all of our phases will be expanded on with the coming weeks, and anybody looking to receive more information can do so through the Ministry of Health and Wellness. Thank you very much for everybody for attending and coming via Zoom, or the very few persons we have here over at the Financial Center.
Okay, thank you very much, listeners, for that. We're going to take your questions, those of you who are here via Zoom, and we also will be accommodating questions via Facebook. So if you do have any questions, this is the time to ask so that we can address them in a manner that is clear. We also have on the Zoom the CEO of the St. Lucia Tourism Authority, Mrs. Beverly Doughty, who will be on hand as well to answer any questions that you may have, especially as it pertains to the reopening of the tourism sector. Yes, we see a hand up, Mr. Peterkin. That's for guys like me, yeah.
Okay, thank you very much, and great job, guys. I have three quick questions. One, and I may have missed a bit of it, so forgive me if I did not get the information at that point. The first is, we keep hearing about the R. I'm not sure what St. Lucia's R is. I think it's supposed to be infection rate, so that would be for the CMO. The second is in the phases and the timelines, at what point do you see, and where does it fit if we've got all our protocols ready, and the airlines also have them as well, and the hotels that are getting people in have them. At what point do you see, what stage, what time, that opening of the international borders will allow foreign guests in, not St. Lucians, foreign guests in? And the last one is something that just occurred to me. We live in a very litigious world, and I can see a situation in which we are, let's say, our office is open, and I'm an accountant, and we're not essential for some strange reason. They've allowed the lawyers out, but I don't know why they won't let us out, but still. When we do get out, and somebody comes to my office and gets infected, and in the contact tracing it comes back in essence to that visit, and that person would die or get very sick and want to sue me. Is there a way that you can say we can get almost like a certificate that we have in fact applied all the protocols, which would give us a defense from anybody being able to say that they traced it back to the visit to our office, which would in fact have a problem with all of my staff as well? Those are my questions.
All right, well, I'll attempt the one about the tourism. We are giving a sort of a start date of June 4th is the date that we have made public. And what we're seeking to do is having the trade, all the stakeholders, so your hotels, your airlines, travel agents, everyone must know by when the borders are open. Because if the borders are not open, then you're not open for business. Of course, we have taken into consideration the risk factor of a lot of our markets, and as well logistically, when you take into account that in the UK and Canada, that they do have a situation whereby you must have a quarantine requirement upon return. It is almost not feasible for ones to travel. That's going to be a deterrent in terms of operating those markets. But it's open, and whenever the travel situation in those markets would change, then it gives us a good chance. It leaves us then with the other main market, which is the United States. With the United States, what we have a scenario is airlines that are indicating an interest that they want to start business by a certain time frame. In fact, airlines were advertising to come to St. Lucia as of May 7th, and we simply said, we are not ready. So what we're saying to the sector is we believe that we've got the protocols ready. So one of the main ones you would have heard is the fact that you've got to test COVID-19 negative before you can actually board. So we've made that one of the requirements in order for individuals to check in. So the list of protocols, from the seating arrangements on the airplane to the taxi trip to the hotel, to the number of buffets you're going to have in the hotel environment, to the situation on property where staff will have to be wearing the various PPE protective gears, where you must have quarantine rooms, for example. You must, for example, have a nurse on property to deal with any medical situation. Your staff must be properly trained. So what the team has actually done is to go through a long list of requirements and safeguards that will help us to mitigate against the potential risk that may arise. I hope I answered that question. Now, the legal question is, I'm not a lawyer. Sharon is the lawyer. Maybe she may want to take that up.
I keep telling you, Minister, criminal attorney, I would defer that to the Attorney General's chamber.
Yeah. So what I've noticed in the protocols for hotels, that hotels, for example, and other businesses, most of the protocols begin this way, in accordance with the Public Health Act. So my reading of that is that whatever interpretation or whatever is within the confines of the Public Health Act, I think that is going to apply. But if you can prove in a court of law, for example, in your accounting firm, that you have met all the guidelines set out in the protocol, then I believe that you will have the facts on your side. However, if the customer who comes to your establishment can prove that your company may have violated any of the protocols, then I believe that you're absolutely liable, because then you didn't follow the guidelines as they were set forth by the Ministry of Health in accordance with the Public Health Act.
Yeah, and so would hotels, for example.
Hotels, for example, yes.
But what I'm asking really is a possibility, just like you can get an electrician certificate, that your electrical works are in order and satisfactory to the government, whether we could get something like a COVID-ready, something to indicate, yes, this organization has followed all the protocols and guidelines,
Yeah.
in which case, that's our defense.
So
Otherwise, very difficult to prove.
In the case of hotels, they do have to apply for a license before. So a lot of inspections will be done, as the team would have highlighted in the presentations here. And if you don't have a license to operate within the COVID era, you just can't open. And that has been set forth. So once you meet all the requirements, you meet the guidelines, you are following the protocols, then you get a license. The various ministries are giving approval for the sectors that fall within their remit. So, for example, the commercial sector, or what you know as the commerce sector, is being done by the Ministry of Commerce. So if the Ministry of Commerce does not give you a letter to operate an establishment, then you simply can't operate the establishment. So there's an application process to the relevant ministry. We have the Ministry of Infrastructure that's presiding over the construction sector, for example. and they are making it clear, these are the guidelines, these are the steps, working in conjunction with the Ministry of Health to ensure that the approvals are clear, what the standards are in terms of sanitization, in terms of PPE supplies, social distancing within the establishment, and all of the various protocols that you must follow.
Yes, so Mr. Peter, if I may,
Yeah, can I just before you do, and so that's fine. So it's kind of like saying, as I say, I'm a foreign operator, I have an office, I got a trade license, and that allows me to operate. Nobody's going to come and check that until a year goes by.
Okay,
so what I'm saying, somewhere along the line, what I would like to see as a citizen is that even those companies that have been given permission to operate, there will be some kind of random checking
Yes, that's correct.
from time to time, just to kind of tick the box and say, okay.
That's correct.
But it has to be random. And this is where you can employ a lot of young people that are jobless to do that work.
Okay, so I think Mr. Peter,
You know, I'm very satisfied the PS want to come in, but I'm very pleased with the level of policing that I've seen, Richard, is that there were a couple of establishments that came close to being shut down. And that is because the team with the police and various departments were going around doing the various checks to ensure that they are following it. So the point that you've made is a very poignant one, but I'm very happy to say that I'm very satisfied with the level of policing that are taken. Are there breaches? Of course they are.
Just 1 second. Wait. Our environmental.
Our Chief Environmental Health Officer is on there. I think we should allow him because they've been doing a lot of the monitoring and regulation. Go ahead, Mr. Ragnanan, go ahead.
Mr. Ragnanan, the floor is yours. Mr. Parker Ragnanan.
It's not muted.
Sorry. Enjoy it.
Mute him.
while Mr. Raghunanan is coming in, what our contribution is just to echo the sentiments of Minister and you, Mr. Peterkin, and that of which the CMO and the Chief Environmental Officer would say, that this is underpinned by a strong monitoring, right, from the Department of Health and Wellness and the Environmental Health Department, but more so just to leapfrog to focus on just tourism for now, because it's one of the really broad-based areas. We have realized that with reopening tourism, there would be a strong demand on the monitoring just to ensure that we keep the risk at a minimum. And what we have been doing with the Ministry of Health is identifying a cohort that will be dedicated to this sector to support the HR requirements for the Environmental Health Department. So essentially, there will be random inspections, there will be assessments ongoing. So the initial check of having met COVID-19 protocols will not be the only monitoring requirement of the Department of Health. We too at the ministry have our technical officers who will be in dialogue with the various properties. So if there's any area for concern, any need to reinvestigate or review any of the protocols, that will be done during the first phase especially, which is the test phase.
1,000 young trained people unemployed.
Yes, so Mr.
New jobs.
Raghunanan.
Hi, good afternoon, and thanks for inviting me. With regards to the protocols, especially for the accommodation sector, each hotel, for example, is expected to use a protocol as a guideline in terms of developing their own protocol per establishment. As Ms. Vittet have said, very importantly would be training and then monitoring of these guidelines to ensure that they are in place. It is important that we look at the implementation of these guidelines. As we understand, the accommodation sector is quite an important sector, and therefore there are some stringent measures that must be administered at the facility to ensure both the safety of the guests as well as safety of the employees at such an establishment. And Therefore, we are continuing to work with the sector, the accommodation sector, the Ministry of Tourism, the St. Lucia Hotel and Tourism Association. We've had some meetings, and it's not final as yet. It's work in progress in terms of the final layout and implementation of these protocols. As David said already this morning, there are a number of other sectors where generic type protocols are developed, and the expectation is that each establishment would use this protocol as a guide for developing their own protocols to be able to suit the individual needs. Therefore, we would be monitoring to ensure that these plans are actually effected. So I hope I've given some clarity to it. Thanks.
Okay, we have some questions on Facebook. If I can just pick those up. Do you want to come in? Yes.
Sorry.
I'm going to ask Dr. Belmar to come in just before we take the questions from Facebook.
The R that is used is really an epidemiological number. And to put it simple, it gives an idea of the rate of infection of any organism. So what it tells you, an R0, say, of 5 would tell you that for every infected person, what's the capacity of that person to spread it to other persons. So a disease that's highly infective, such as, say, measles, the R0 for measles would be about 15. But in the context of COVID-19, the R0 is about 2 to 3. So if we have one person with COVID-19, our contact tracing normally takes us to about 30 people. Normally for each person, your contacts would be 30, 40, 50 persons. But out of those, what we normally see is that you infect 2 or 3 persons from having COVID. Now, this can be higher if you are a very active person and remain close to a lot of people. But generally for COVID-19, the rate of spread per person, per positive case is about between 2 and 3.
Do we have a rate? England has a rate.
Yeah, ours is about the same from what we saw from our contact tracing. We normally are able to get 1 or 2 positive close related to them.
Okay, so if we can just take some Facebook questions. The first one is, what is the COVID testing time frame prior to travel? That one is simple, 24 to 48 hours, as indicated in our protocols. Facebook question number 2, when can repatriation flights from the UK begin? Beverly Dottie, do you want to pick that one up? Question is, when can flights to repatriation flights from the UK begin?
Currently, there is in the system a BA flight that starts the 1st of July that there's an ability to book, notwithstanding the recent quarantine implemented within the UK. May impact whether or not this flight remains available.
Thank you for that, Mrs. Dottie. This is a question for CMO. When can we open restaurants and bars? And are they allowed to open, and if so, when? Restaurants and bars.
Based on our scheduling, right? Again, it's the emphasis being placed on what you perceive as opening restaurants and bars. It's not going to be what it is and was before. So currently, the bars, the protocol that's established is going to remain in relation to how persons are able to access liquor, and moving forward in relation to how restaurants are allowed to operate would continue, where we would be asking persons to continue to do the takeaway, and where we move to in-dining, the idea of in-dining would not be in-dining as we remember prior to COVID. It's going to be very radically different. And this is where things like when we refer to functions under phase 4, we would be looking at the seating arrangements in restaurants, and say, for example, you had an award ceremony, how that is adopted would be very radically different. CMO, did you get a chance? Do you want to speak some more about some of the guidelines?
For the restaurants and bars?
Yes.
Okay, when we do, and at this point, the seating within the restaurants and bars, seating within restaurants and consumption at the bars, that has not yet been approved as yet. But when it is approved, there will be limitations to the number of people within an establishment at any one time, and also in relation to the increased disinfection practices at the place. And in relation to the restaurants, for example, the buffet would not be allowed. It would have to be direct service to reduce the number of people over food being shared. And what we normally see in restaurants with the number of tables and chairs, that would also have to be adjusted. So these are just a few of the measures for that sector.
Okay, before we go to the Zoom, we just want to ask Dr. Belmar, the new protocol for schools.
Just 1 second, Minister. But the proposed date that we have for the restaurants and the bars is the 1st of June, if I was not clear before. Thank you, Minister.
Sure. So CMO, this one is for you. What are the protocols for schools, specifically as it relates to grade 6 and Form 5s?
In relation to facilitating our grade 6 and Form 5 students, the protocols I'll speak to, for example, for the grade 6s. Usually our classes have about 30 and 30-something students at any one point. So this would mean a reduction in the number of persons per classroom. So the number of students allowed at any one point will be less for instruction. Also, in terms of the times of school, a lot of the normal activities that happen at school, for example, the group assembly and prayers, those activities will not be allowed. The PE activities as well that allow for groups of students to be together, those activities will not be allowed. And it will only be between a 3 to 4 week period to allow instruction for the two critical groups. So the school day will be reduced. Also, the school day will be reduced. The recess period will be limited to allow the children to have their break. The students would also, the school has to ensure that there is running water to allow operation, and the regular infection and disinfection procedures would also have to be in place. The schools were also asked to look in terms of occupational health and safety for the teachers, because we're looking at both the staff and also for the students. Teachers who have reduced immune systems, something would have to be looked at for them. I want to point out that it is just the grade 6s and the Form 5s and those subjects which have a practical component that we are looking at this time. All other students will continue with the online modality until a decision is made later on to facilitate them. We also recommended that the minimum standards for grades 2s and 6s be cancelled as well. So these are some of the measures that are put in place in the school protocol. Just
okay.
to
we go to Zoom now for another question. We have Dr. Ampadu. It's when exactly will churches be allowed to open after putting all protocols in place?
Okay. With the protocols for the churches, and this protocol is managed through the Ministry of Equity with the social transformation officers. This protocol was shared widely about 2 weeks ago. Within this protocol, what we asked for all of the churches to submit their plan to us, because the different churches have different sizes. We also know, so based on their plan, it would indicate how many persons that can come into the church for a service. And once the plan is received by this ministry, the officers would do a review of the facility to ensure the infection prevention control measures, for example, are put in place. That is, there is hand sanitizer, look at the spacing of the seats within the churches. We also ensured that some of the practices based on some of the religions would not be allowed, such as hand shaking, to allow the communion through the mouth, and some of those measures for now would have to be stopped. So usually it asks for 3 business days that it be submitted before the church is required to reopen. So it would mean some of the churches could allow people in, the rest would have to continue online based on the size of the church. So this is already implemented for weddings and funerals, which we note are higher risk. For inside of the church is limited to the square footage of the church, and we are still very concerned about the number of persons who may, from the reports that we have gotten, attend the burial at the cemetery. So we want to ensure that even at that location, that physical distancing is maintained, and also the use of masks at that level as well. The wake after the funeral is a mass crowd event, and it is still not allowed at this point.
Thank you for that, CMO. At this time, I want to bring in our Prime Minister, Honorable Alan Chastanet. Prime Minister.
Thank you. A question that was asked with regards to the opening of the borders was if we're saying that the test has to be done 24 hours or 48 hours before arrival, in most countries right now to get the PCR test takes anywhere between 4 days to 3 days minimum. So how do we are going to manage that process? So I want to say that the June 4th date is a date that we have established that we are ready for business. I want to make that very clear. But in this scenario, it's not about just us. Everybody else has to be prepared. If you recall, when we first started engaging the population on this issue, we said that we have 2 battles. We have 2 wars. We have a COVID war, which is a health war, and we have an economic war as well. And that sadly, that you have to focus on the health war first, because if you don't solve the health war, you can't start getting on to deal with the economic war. St. Lucia has done an incredibly good job, if I can say so myself, in dealing with the COVID war so far. And I want to keep reminding everyone that this fight with COVID is not over until we have a vaccine, or that we see, like SARS, that if it disappears. But that is not the case right now. So we must stay on alert. But it means that the amount of resources that we have to dedicate aren't as much, but more importantly, it allows us to get on with the economic war. What we clearly understand is that we are in control of our own domestic economy, so stimulating growth through construction, the IT call centers, agriculture, all those things are critically important to us. But to open up the international borders means that all of the source countries themselves have to have won the war or be in a similar condition as St. Lucia in having COVID under control. So let's look at our core source markets. United States of America. Sadly, the numbers are still increasing. The UK has had more deaths than any of the other countries and is now imposed a travel quarantine, meaning anybody coming into the UK has to go 2 weeks into quarantine. Canada has done the similar thing. So until they're in better control, it's problematic. So what St. Lucia is saying, considering where those countries are at, and given our state of preparedness, we are prepared in the initial stage to coexist with COVID. But at minimum, what that requires is for a person to be tested. As we speak right now, the only globally accepted test is the
PCR.
My dyslexia comes in. PCR. I always say PRC. PCR test. And that's why I always have to have the CMO close to me. That's the only one that's been accepted. Now, we believe that within the next couple of weeks or sooner, that rapid testing will be approved. We don't know when, but we believe it will be. And rapid testing, in our opinion, will play a significant role in opening up the international markets. I again want to be very clear that I'm not contradicted or misunderstood. Testing does not entirely eliminate the risk. It doesn't. What it does, it reduces the risk that we're taking. That's what it does. But we've realized that there is some element of risk that we're going to have to live with, because the economic fallout that all of us are encountering is catastrophic. The government revenues are down 50%. And if in fact the tourism industry is not going to be revitalized in any meaningful way, meaning that we start seeing at least 50 to 60% occupancy in all of our hotel sectors, and that persons are re-employed, their contribution of the tourism sector's revenue to the government will not be felt, at least in part, until September. But the likelihood, as we speak now, is that we're projecting at the end of the year. But the reality is that we are losing $50 million a month. And you ask yourself, how does a government lose $50 million? Is that we went through a budget process in which we expected to receive $920 million in tax revenue, which is about $78, $79 million a month. And we're currently collecting 50. So that's $27 million a month that's short. So for instance, my civil servants, who I have the greatest amount of respect and appreciation for, when they say, oh, you see, the government paid salaries last month, it meant that they had the money. It wasn't that the money was in a mattress somewhere. The money came from not paying other persons' bills. And that's why we're carrying $71 million in payables. And when we pay salaries at the end of this month, which more than likely we're going to have to, that the money's going to come from the same thing, not having to pay other bills. It's not like it's somewhere and then we have it in hiding in savings. So in addition to the cash shortfall of $27 million, we have bonds and treasury bills, which we have $700 million of them rolling over this year. And we're assuming, and so far our assumptions have been correct, that 25% of the people who have bonds and treasury bills with us are going to want to cash out, meaning that they need the money themselves. That is another $15 million a month. And it can't continue. So what are the solutions? The solutions are to try to stimulate the local economy, to raise the revenue from 50 million to maybe 60 million or 65 million, to try to open up our borders, but we don't control when our international borders are opened. We can control what we can do in saying to the world, St. Lucia is open for business, but it still requires those countries to be in a state of preparedness and with the capacity to handle international travel. Let's face it, persons are not traveling from Miami to New York. They're not traveling from Miami to Los Angeles. And there's planes for people to go on. There's nothing preventing people from flying. But there's still a fair flying. That's not within our control. So I'm saying we have to come together as a country. The government can only deal with what the realities we have. We are doing everything we can, and I'm proud of what we've been able to achieve in dealing with this from a healthcare perspective and in protecting the health of solutions, because that was always priority number one. And we've succeeded so far in doing that, that no one has died.
0 positive cases.
And that we have 0 positive cases on island. The next battle is this economic battle. And so you will be hearing much more from my government on a regular basis as to how we're going to deal with it. I mean, it was interesting to note that the government of Barbados now is talking about the possibility of also offering bonds. And I indicated to the civil servants at the time, the bond offering was not a pay cut. It was a deferment. But the reality is that government is going to have to figure out how to cut its cost of operations somewhere between $20 to $30 million a month. Because we're not in a position to continue borrowing money to pay for debt. I've repeated myself over and over again. You cannot borrow money to pay for debt. And it's going to require all of us to be mature and responsible as to how we want to proceed. And this continual debate as to whether we should continue capital projects must stop. The capital projects are funded outside of government's recurrent revenue and are going to help to generate jobs for many people who are currently unemployed. And at some point, the world will recover from COVID, and we will get back to pre-COVID levels. So you can't just sit back and do nothing and simply borrow money every month to pay for debts that are not generating any level of productivity. So I want to say that once we've gotten past this stage, and that's why this stage was so important, that we're not giving persons a 1-week update on what we're opening, but a much longer term view as to what it's going to take to reopen this economy completely. And until there is a vaccine for COVID, how we're going to have protocols in place to continue to make sure that we achieve priority number 1, which is to protect the health of all St. Lucians. And we will also now be addressing our attention aggressively on how to resolve this economic crisis we have, which potentially can undermine the social fabric of our country if we don't address it early enough. But it's not going away. Thank you.
Thank you, Prime Minister. So some of the other questions that we've been receiving have been, when are we removing the zones? So we are proposing that coming next week, Monday, there'll be the removal of the 2 zones, and that we will no longer have that internal restriction, especially because we will be opening up all of the sectors. In relation to some of the protocols that would be permitted for our public transportation, I hand over to CMO to give us some guidance on what public transportation would continue to look like right now.
With the removal of the zones on, I think Monday is May 18th,
That's correct.
the protocols for transportation would continue with the reduction in the number of passengers on board the buses and the taxis. So we would not allow the full buses, and that is dependent on the size of the bus, to ensure that the passengers are on the opposite sides of the bus to reduce transmission. The infection control measures that were put in place will remain, which include the regular sanitization of the bus and the use of the availability of hand sanitizers on the bus, and also the requirement for the use of masks while on the bus. But the restriction that occurred before, where the buses could not transport persons across the zone without permission, this will be removed as indicated by Mrs. Hippolyte.
So we go now to Facebook for some more questions. We see
Minister?
can returning nationals.
Sorry, Minister, there were 1 or 2 more I just wanted to address that we received, if you don't mind. Thank you.
Okay.
Thank you, Minister. Someone asked what was the date for the school? What was the date for the schools to reopen for the grade 6 students and the Form 5 students? And that's the 2nd of June, because the 1st is a holiday, so the 2nd. But the objective is to allow for them to be able to come in, to be able to do for their exams. So the common entrance exam is estimated to commence on the 30th of June, and the Caribbean Secondary Education Certificate exams would also commence on the 29th of June. But we're allowing for the month of June, as CMO indicated earlier, with strict protocols for persons to be able to come into class, only those 2 areas. There was also a question in the chat in relation to beauty items. It would be for the sale of items for the opening of beauty hair salons, but everybody needs to understand that you first have to get your guidance. You first have to get your protocols from the Ministry of Health. You cannot just open on the 18th of May. Everybody has to get their guidance, the general guidance, the specific guidance, and then also the evaluation done by the Department of Environmental Health. But we are providing you with this date as the opportunity for you to now get yourselves together and to start to mobilize towards this date. If it is that you have not implemented all of those things by that date, you cannot open on that date. If it is that you're only mobilized by the 20th of May for your specific shop, then that is the date that you are to be able to mobilize for. But we are letting you know that come this date, as based on the SI that will be published, these are the new services that will be provided. Somebody asked the question again in relation to the judiciary, saying that it's going to full operation on Monday. We need to understand full operation is no longer full operation in your mind. Full operation is what your sector can allow and perform to allow to happen based on all of the new protocols that we have to have in relation to COVID. So please, when you think of anything about full operation prior to COVID, take it and pack it away. This is not going to be our life moving forward and finding our new normal. There was...
Are you done?
Yes. No, 1 second, Minister. There was one more question in relation to quarantine for returning nationals. What is the proposal for returning nationals? So with the opening of our borders, we would be allowing for seeing if we can now look to get persons in from our wider diaspora, our students, our people who had gone abroad for whatever reason and have not been able to return home. So when we speak of opening our borders, we would be allowing for those persons to come into St. Lucia. However, they must undergo mandatory quarantine, and I will hand over to CMO again for her to take us through a couple of those things.
Based on the level of risk that is still out there, anyone coming in would have to be quarantined. As we have been doing, an assessment is done on the home. In some cases, based on the conditions, there are persons with health conditions and special circumstances that require home quarantine. So after we do that assessment, as we have had to do in a few cases, if they have the capacity, that is, they have a room and a bathroom which is separate from the rest of the house, and they do not have persons with risk factors within their household, home quarantine may be allowed with the regular assessments of the nurse coming to the home. But as we have noted, the more efficient and needing a reduced human resource is the institutional quarantine, which we have been doing for the majority of persons coming in. So quarantine will remain as a feature even after the borders are open.
So we have some questions now coming through on Facebook. And there's a question here, CMO, that's related to the last one, and it has to do with OECS nationals and quarantine requirements. Are OECS nationals required to quarantine?
Yes, everyone will be required to quarantine coming in to the island. But let me just indicate that in terms of restrictions, what we do when the borders are open, we regularly look at the risks, that is the incidence of cases around the world. We also look at the capacity of the country to manage and how those cases are being managed. From there, we also look at the CDC advisories and indicate what the level of risk for those persons coming in. So what we anticipate, and that will be done closer to the date when that is confirmed, we anticipate that even our OECS nationals would require quarantine.
Okay, what are the protocols for daycare services? When will they be allowed to resume? Daycare services, preschools.
Preschools remain in the schools bracket. We have not given a date for all schools to return to normalcy. At this stage that we are at, we are facilitating the grade 6 and the Form 5s. So we are still monitoring to look at when the new term can open and how. That will be done at a later date.
More questions coming through on Facebook. When will the buses be able to operate between the north and the south of the island?
We answered that one a short while ago, indicating that come Monday, the 2 zones would no longer be in effect.
Okay. If you would like to reiterate, because other questions are abounding on Facebook about the protocols to be monitored and policed. So maybe you can reiterate that again, because that has come up a few times here on Facebook, to indicate, to reiterate, how will the protocols be monitored and policed? I know you've addressed it, but just for reiteration.
For most of the sectors, our environmental health officers have been monitoring those organizations, and they have been doing random monitoring as well to ensure that the measures are kept in place. And some of them are done through the respective ministries. For the commercial sector, there is a protocol where the businesses have been applying to the Ministry of Commerce. But based on the number of businesses we expect to commence on the 18th, those guidelines have been shared and they will further be made available so that the commercial sector can review them prior to opening. But the officers will be doing the reviews to ensure that there is, that they adhere to.
Thank you very much, team. I don't know if there are any questions on your end that are coming through from the chat, Sharon, but I seem to have no more questions on Facebook. I'm going to give the head table to have their final words. Richard, do you have any other questions you would like to ask? Yeah. So we're going to just allow a few more questions before we close.
This is just one really, and it came in on my WhatsApp, but I guess it was a question about what happens probably in relation to people coming and tourists coming in after they've been tested, because how long do they kind of go into a quarantine before they're allowed to travel again, which I don't think is the answer, because I think one of the issues that some people have is that when you test, you have to test and test and test. And so if you have somebody coming in for 8 days, how many times do they have to be tested? And in the hotels, who is doing the testing? Is it trained hotel staff? Is it Lucian staff? And as I say, and is there because I don't think you can say you're tested once and then that's it for the entire period that you're here. So that's what I guess the question is about.
CMO, would you like to pick that up? And we have some reactions from the PS in tourism as well.
In relation to testing, the gold standard for testing remains the polymerase chain reaction, the real-time polymerase chain reaction, which is called RT-PCR. This test is 99.9% accurate. This is the test that actually picks up the genetic material of the organism. In the developing world, they are looking at a number of rapid tests, which would be the more convenient one, but then to date, there isn't a rapid test which is efficient or as accurate as we would like to be able to rely on. But a lot of work is happening now, and we are really hoping that by the time we open up our borders, there'll be a reliable enough rapid test to give you that idea. Now, if you think about it, a test gives you a result at one period of time. It doesn't mean that in the next 5 days you can't get into contact with someone with the virus. So what we have done is put a number of layers to ensure that the possible risk of someone coming in is reduced. So if a visitor is coming in with one layer at the time before they travel that they were negative, they go through all of the protocols to get to their facility. The hotels would have to have a medical station for them to open up within their compound. And the temperature checks would be done there and reported to the ministry of all of the staff, of all of the guests as well. If anyone were to develop signs and symptoms of COVID-19 or fever or any illness, the testing is done at one point within the public sector through the Ezra Long lab. So we would take the swabs as a sample to be tested. At this stage, there isn't the capacity for the hotel to do testing. If, however, an efficient and accurate rapid test does become available, we would be looking to see to reduce the timing, because the PCR testing, it's a test that takes, by the time it's in the lab, maybe 4 hours to get a result. So we are looking to improve that with the technology coming forward. But it would not be the hotel doing their own testing.
Okay, I want to bring in Sharon, Mrs. Hippolyte now.
Thank you, Minister. There was something that was brought to my attention that was not clear. So with the zones being removed, public transportation between the previous zones would now be allowed. So you'd be allowed to go back and forth between the north and the south of St. Lucia, but again, emphasize what CMO indicated in relation to public transportation or any type of transportation, that people have to practice certain protocols in relation to the number of persons in a vehicle. So even if I had to take, for example, a private vehicle, if I were taking my private vehicle and I would then pick up a passenger on the road or pick up a friend, I couldn't just pick up a passenger on the road and have my entire family in that vehicle. That would not be permitted. That would not be allowed. So persons again need to remind and ask themselves, what was my previous idea in relation to what life was before COVID? Take it, put it in a box, forget about it. Let us now start to think about what life looks like living and working with COVID. So again, the question is asked about, with more services opening up and parents going back to work, this is why we have left it with general guidelines, specific guidelines in relation to workplaces. And whilst again we have referred to full operation, what persons perceive as full operation, this is for your businesses to take into account and to be looking at all of the different things. So CMO spoke a while ago about persons who have who are high risk in businesses that operate if you have your immune system is compromised or different things. You have to look at perhaps rotations and all of these different things while you look at your business moving forward, working with COVID in this era. There was one other thing that was indicated, right? The curfew is going to be from 9 p.m. moving forward on the 18th of May to 5 a.m. So we would be expanding the curfew hours, but the curfew hours remain in effect. There was a question a while ago on the chat where it asked about masks. People need to be reminded that masks is required as part of the SI. It says, in an effort to prevent the spread of COVID, a person shall wear a mask or other covering fitting over the nose and mouth when in public. The following section says, any person who contravenes this order commits an offense and is liable to imprisonment. So please, contravening the order by not wearing a mask is an offense that you can be charged with.
Okay, we're going to have final words from our panel. We don't have any further questions in the chat room nor on Facebook. Thank you all for joining us via the various radio stations. I'm going to begin with some final words from the PS in Tourism, Ms. Donalyn Vittet.
Okay, thank you. Thank you, Minister. Just want to leave with St. Lucia that we understand the circumstances we are all faced with at this time. But I have a bias for tourism because I I was appointed as the Permanent Secretary in the Ministry of Tourism, so I definitely need to give some attention to my area if the command center allows me. Just want to make an appeal that although some persons in looking at the protocols may see it as an invasion because it's not our normal lifestyle, and I join in Mrs. Hippolyte when she speaks of the new normal. We now have to shift focus to what the new normal looks like and seeing how we can coexist with this thing called COVID. And so the protocols are an attempt to safeguard you as a participant, as an employee, to safeguard you as a business person, and to see how we can now shift our minds, get this paradigm shift to immerse ourselves in what our new existence might be for an extended period of time. Although for tourism, we're starting on, the focus is on accommodation, tourism taxi, and dayboat charters. In no way is it the intention of the ministry and the government of St. Lucia to force locals out the participation of the tourism industry. It is really in an effort to safeguard you, to safeguard our population and the guests that come in, to really limit the interaction, minimize the risk, and so that we don't overwhelm our health sector. So we ask you to be patient with us, and the harder you work with us, the more successful we are, the better we are able to include additional tourism services and businesses as we move forward. But you have our commitment that if we're not satisfied with the level of performance of the sector, that we will be reverting based on the presentation made this morning. At each stage, even at the beginning, middle, and I hope we have no end of phase 1 to move into phase 2, where St. Lucians will really start to benefit and come out of that crippling livelihood that we have been in for the past months. But at each phase, we will ensure that we have the commitment of the Department of Health and the Ministry of Tourism to ensure close monitoring. And I must say that out of discussions with the SLHTA and the hoteliers over the past days, there is a very strong commitment to abide by the protocols, and more importantly, to see how they will bring in as many staff as possible based on the demands that we would get from the market, so that persons could start to live a normal life. So you have our commitment that will be very vigilant, and of course we ask for your participation and commitment as well in that process. Thank you.
Yes. Okay, Minister, if I can just interject at this point, I just want to clarify something, that all of the dates that we've indicated are proposed dates for us to be able to move forward. Particularly in relation to education, it's a proposed date. And if it is that all of the protocols and guidelines have not been able to be implemented, then as again reiterated by the Permanent Secretary in the Department of Tourism, we'll be in a holding pattern. And we will not allow to move to that phase until all of those protocols have been properly established and implemented. So in relation to this, I also want to remind people that coming Monday, the 18th of May, we are hoping to have the SI published with these services being provided. If I can just ask for it to be brought up on the screen again for me, please. The third phase, and as I have indicated on a number of occasions, this is the third iteration, and we will be in this holding pattern for approximately 2 weeks until the 1st of June. And the services that we are looking here to allow to operate, which were not operating before, are your beauty service sectors, your general malls and shops, your other government agencies, your call centers, gyms and exercise, your sports, your beaches. But I need everybody again to appreciate and understand, full operation is not what you thought full operation was before. It is very different. So you must contact the Department of Health and Wellness to establish what your protocols are, what your guidelines are. when they are specific as well to your area. Most areas, the guidelines have been established, and environmental health will need to visit and make sure that you have implemented the protocols efficiently. If you have any questions, you can contact the Department of Health at...
Let me just indicate that for the commercial sector, remember it's through the Ministry of Commerce, right? For the commercial sector, it's through the Ministry of Commerce. For the churches, the faith base is through the Ministry of Equity. I think for most of the others, it is through the ministry, through the Department of Environmental Health.
Yes. So Department of Environmental Health, DMO?
Yes. 468-3700, if my memory serves me correctly.
And for persons to also be aware that all of the protocols will be made available on all of the government's websites. So you'll be able to go and access, and the Ministry of Health website, so you'll be able to access and to observe and to see the protocols. If you have any questions, you can contact the department, and the information will be on the Ministry of Health's website.
Okay, CMO, can we have final words from you, please?
As a way of conclusion, I just wanted to indicate that in terms of our numbers, we are quite pleased and encouraged as to where we are today in the management of COVID-19 on a national level. But I also want to make it very clear that COVID-19 still remains in the environment around us, and there is still a risk out there. It means the Ministry of Health, as the Ministry of Health, we have to maintain our level of vigilance to ensure that our public health capacity and our clinical capacity is there and is maintained to manage any cases or any new cases that can come up. The risk does increase as we open up. The risk of COVID-19 does increase. So the public, we advise you to continue working with us to keep our numbers down. So some of the measures that I have been saying at the end of almost all of my updates, it is extremely important that we maintain them moving forward. The measures include the regular hand washing and the use of hand sanitizer. To ensure you cover your cough and sneeze. If you have any respiratory signs and symptoms, that you stay at home or you seek medical care through 311, through our respiratory centers, which is accessible at the level of the various respiratory centers within the communities. We also ask that you use a mask whenever you are leaving home, and you maintain your 6-foot distance from anyone. You ensure you keep this distance for physical distancing at all times. We also ask that you not encourage mass crowd activities and events. We also keep the stay-at-home measure. We still encourage people who can stay at home, especially if you have chronic conditions. We need to continue protecting our high-risk group to keep them safe and to keep them healthy as well. We also ask that if one of the risks that we have had is persons coming in with unofficial ports, we ask that you inform the necessary authorities. This has led to us getting cases that are not linked. We really want to reduce this impact. So please don't encourage persons coming in. If you know of them, please let us know so we can ensure that the quarantine measures are in place to protect you and your community. As usual, we remain available, and we ask you to look for information from credible sources, such as the Ministry of Health on all of our pages, as well as from the World Health Organization. We also note that there is a level of fear still in the public, or still a lot of information. We want the public to ensure necessary behavioral measures are met, that we act responsibly. I think if we continue and we strengthen what we do, we can
live safely with COVID, but ensure we do it in the safest manner.
Okay, Mrs. Hippolyte?
Yes, thank you, Minister. Again, just to emphasize that, if you can continue to work from home and your business can allow for you to continue to work from home, please do so. Use your online things. Use your Zoom. Use your team meetings, your Microsoft, because based on the requirements from the Office of the CMO, you cannot have the same number of persons in the same square footage like you had before. So I need everybody to appreciate and understand that. Just one last thing, just to highlight if there was any confusion, restaurants and in-dining, not looking to focus on in-dining until later on, until the 1st of June. Right now, we are still in that holding pattern where we are opening up the services, but we would be looking to restaurants and in-dining on the 1st of June. Yes, Honorable Prime Minister, over to you, please.
Thank you very much. Again, I think that all solutions should be very proud of the work of your professional team that are here today. And as I said, and I think that they would all agree with me, that they're simply the faces that we have come to know, but they are hundreds of persons that are behind them, that show up to work every day, put themselves at risk, travel on buses, even on a reduced schedule, stay the extra hours to make sure the work is completed. This is the kind of effort and unity that we're going to need to see us through this incredible crisis. We're not facing this crisis alone. And it's not ever going to be in my nature to compare St. Lucia to other countries. What we must do is make sure that we take care of our backyard, our yard. And we can only succeed if we continue going down the road that we are right now in being each other's brother's keeper. That's the truth. And I have to say to you that St. Lucians have really come out in large numbers and with the greatest amount of community spirit. And I want to thank all of you for the efforts that we've made to date. I see my acting commissioner of police, and I really want to thank and commend the police officers for the work that they've been doing. And I want to remind St. Lucians that it's important that we are on our best behavior so that police officers are not being called to do unnecessary things. And certainly when persons have partaked in the spirits and the joy of having their spirits back too much, sometimes that leads to unnecessary activity that requires the police officers to come. Once the police officers become involved, then it becomes the nurses, next in line. And they are under enough stress as it is just dealing with our normal healthcare situation. What we don't want is for it to be compounded by COVID. The work to get Victoria Hospital is well on the way, and I want to thank the World Bank for resourcing a loan and facilitated us to have this, I think, world-class facility. I mean, when we first started about doing this, we were talking about just making it very basic. The World Bank has required us to take it to an international level, but we should be very comforted in the fact that if we do have any kind of outbreaks, that we're in a much better position to cope with it. The challenges for COVID are multifaceted. When we think of our St. Lucians who are on cruise ships and don't believe for one moment, and that we don't appreciate the psychological difficulty that some of them went through. The reality is that persons on the ships, thankfully not St. Lucian, have committed suicide. The psychology of being isolated is stressful, even here in St. Lucia. But imagine being a student away from home. And as I said, I've spoken to some of those persons, and I can feel the compassion in their heart. I can feel the longing to be home and to be with family. So even what is perceived to be a safe environment, there is fallout. And we will be remembering this period for a very long time. But we can make it much easier on ourselves by continuing to work with each other and continuing to show compassion and care for each other. And do not believe that you ever understand what it is to be in another person's shoes until you yourself have walked in their shoes. I say this because this is the level of empathy that's required for us to succeed. Your government will continue to do everything that we can to make this as comfortable as possible. But it is a difficult task and a daunting task that lays ahead of us. And simply that the level of uncertainty is what is the most stressful part about this. And I know, because even in my own household, I have family members that like certainty in their life. And the not knowing from day to day what the outcome is going to be causes a tremendous amount of grief, tremendous amount of stress in their lives. And we must be cognizant of that when we meet people. And if persons seem to be a lot less short-tempered, we need to understand that this is not normal times. And we have to continue to support each other in this endeavor. So I just wanted to close by saying how proud I am of the professionals that are working in government. I want to thank all the persons on the front line, and sometimes the forgotten ones, the security officers in our buildings, the watchmen at night, the administrators at the hospitals and the healthcare centers. And again, these are the faces that are behind the scene. And I remember after 9/11 that we grew to have a greater appreciation of firemen and police officers who ran up a building to save other people's lives, not knowing that they were running to their own deaths. So even in our community, reaching out to these people, to these persons who are every day doing the right thing, bringing fruits, cake, some sign of saying, I see you, I hear you, and I'm thankful, is important. We're only going to make it through this together. On my part and the part of my cabinet, we will continue to do what we think is the right thing. Is it always going to be the right thing? Maybe hindsight will prove us wrong, but I assure you that you can be safe in knowing that it is with the best intentions. And it's not always an easy decision to say that we're going to have a 24-hour curfew. It's not easy to say that we're going to limit access or eliminate the access to liquor. It is not easy to say that we have protocols that stop people from being able to go to church. These are not easy decisions. But sadly, these are decisions that have to be made sometimes to see us through what we're doing. And I want to really thank, again, the police officers, the nurses, and the many of you that have sometimes not questioned those decisions, but simply implemented them. And I know it's not been easy. I want to thank my staff at NTN, who, very quick notice, have put together, I think, a phenomenal platform to keep the nation updated on what's transpiring with COVID, whether it's from a social perspective, a health perspective, an economic perspective. I want to thank all of the TV stations and the radio stations that have supported that NTN platform to help bring this information. And I was just saying to the minister that a forum like this, in which we're allowed to have as many people as we have online, as well as the number of solutions who are listening to us today, that they can hear the information live and direct. And the CMO is 100% correct. It is difficult enough to achieve this when it's added to fake news. And I don't know why persons would want to do that at this time, because it's easy, because the level of anxiety is there. And I'm asking all of us to continue to participate, to check the sources of the information, and stop trying to scare people who are already very anxious. So with that, I just want to thank the Lord for his continued blessings and his guidance, and hopefully that we are living up to him in our own efforts, because we're here to serve him ultimately at the end of the day. So thank you, and God bless you all.
Thank you. Thank you very much, Prime Minister, and thanks for you for watching. Thanks to all of you who joined us by Zoom today.
Continue with
the doctors, the nurses, and thank you all for joining us by Facebook, all the radio stations who joined us here today to make this simulcast very possible. We thank you all, and this brings the meeting to an official close. Thank you very much.
From the officials at the front line of our response to COVID-19 here in Florida. I just want to let you know that government has just concluded the national consultation on the framework to reopen St. Lucia's Society, and the program just concluded with the Honorable Prime Minister Alan Chancellor, a very emotional Prime Minister, just speaking on recognizing frontliners, as well as recognizing the difficulties that surround those that surround us at this time, the difficulties that many are facing, those unemployed, those workers who are not certain about their future at this time. And just to go over this morning's national consultation on the framework to reopen St. Lucia's Society, we saw the opening statements from the Honorable Prime Minister, the plan to be presented by the St. Lucia's Command Center team that includes the Chief Medical Officer, Dr. Sharon Belmar-George, as well as the Delivery Unit Director, Charon Gardner-Hippolyte, and the Permanent Secretary for Tourism, Donalyn Vittet. And the Prime Minister did explain that the 5-phase strategic reopening focused on health, of safety, and the general well-being of the public, and has taken into account the advice from the public health experts and feedback from various stakeholders. We got word from the officials from the command center that we are in the 3rd phase of St. Lucia's COVID-19 management and the 3rd iteration of this cycle, and that is the increased incremental operations. And you would have witnessed this even prior to today. We saw the introduction of the construction sector being allowed to reopen, as well as other sectors so far, commercial, retail, all of it in a phased approach. Of course, as the command center officials indicated, to monitor and assess with each tier that is added in terms of the reopening of our society in full. We got word that effective June 1st, we will see the reopening of the tourism sector, and a lot of considerations being made under this reopening. We're seeing the individuals who want to visit St. Lucia must test positive before they're allowed to even fly into St. Lucia. Also considered the licensing and the certifications program for individuals who will be returning to this sector to take into account the changes, the new normal that will be in effect for now that we have to deal with COVID-19. The first week in June, we will also see other sectors opening up, barber salons, beauty salons, general malls, and government agencies, call centers, gyms and exercise facilities, as well as the beaches will be opened. All special conditions being made and being put in place for the reopening of these. We also got word from the CMO, Dr. Sharon Belmar-George, that 59 more tests came back, all negative, thankfully so. Also word that the borders will be reopened. So we will not be having the zones anymore, the 758, 759, as you would call it, will no longer be. Persons will be able to freely traverse to and from the north and south of the country. But again, the ordinances within the curfew order will still apply. So in terms of the number of persons that can be allowed to drive in one particular vehicle, etc., these will continue to apply. We just want to let you know also restaurants and dining will be allowed to resume operations in the first week of June, so that is also important to note. And just going through the special announcement, the important developments that we're getting from the command center this morning, we want you to stay tuned to NTN, because tomorrow, Saturday, as we look at the week that was, we will be delving into the specifics, what is new about our COVID-19 management so far. So you need not worry that you may have missed today's proceedings or my summary or synopsis. We will be delving into what is new, what is the new information that we're getting from the command center so far. Just want to let you know some bulletin information. The Royal St. Lucia Police Force will be joining the COVID-19 response report team on Monday, live from NTM. So we do hope you could tune in for that. There are so many important developments that we want some information on from the Royal St. Lucia Police Force's Commissioner Milton Daisy. So he will be there giving us that update. We also have an update from the electoral department, and I just want to read it out. As we continue to observe the health and safety protocols in light of the COVID-19 pandemic, the electoral department wishes to inform the general public that we are providing all our services at both locations, Castries and Electoral Sub-Office in Vieux-Fort, from 8 a.m. to 12:30 p.m. commencing Monday, May 11th, 2020. So we hope you do take note of that notice. Carlton?
Merci tellement, Jessie. Et bien, là, on est, messieurs, nous venons en bout de consultation, ça. Yon pour moucher un plan pour vier ouvert pays, avec la bonne table, nous tenons 6 mois. Parmi l'autre monde, nous tenons là, nous tenons Gardner-Hippolyte. Et plan, c'est moun ça, c'est eux qui sont responsables pour bailler guide, pour bailler premier ministre du pays direction, là, ils viennent pour manier ça qu'il fait. Quand nous tentons tous ces moun ça parler, et nous venons boucler aujourd'hui, et nous avons demain, si Dieu veut, nous avons pli, nous avons un détail, nous avons savoir qui manier bagaille à aller, et manier pays à vie ouvert encore, c'est un plan qui est les venus pour sécurité nation, les venus pour manier ça qu'il plan. Nous tenions bagaille toutes ces moun ça, bagaille pas qu'on la coutume, il pas normal. Tout le monde, et bien tout ça qui est fait, qui ni pour fait et puis conditions. Quand on était puis nous faut changer aussi des mots qui ont pris annoncement du Premier ministre là, et puis aussi nous quand ni lundi ce police là qui a parlé ben nous ça était supposé point coup ordia, mais as a résultat du meeting ça il pas qu'à faire quoi. Nous remercions tellement avec nous cadeau veiller pour conditions avec manière pays à vivre ouvert en consultation qui était en place ici la Point Seraphine en building administration. Tous les gens GIS et puis management puis travailler ici nous avons dit merci tellement pour vous qui suivent nous.
Thank you very much. And again, this concludes the national consultation on the framework to reopen St. Lucia's Society. Just giving you information that there will be an incremental, there will be a phased approach to the reopening of St. Lucia's Society. We've seen several sectors begin to open, but we will be giving you detailed information on how that will happen. Of course, we have the interim phase before June 1st on how that will happen. Stay tuned to NTN Live for the updates as they come. My name is Jessie Leonce. Carlton Cyril signing off for now. Do stay tuned. say it's 1 o'clock.
Yes. Jesse. You check that.